Neuroendocrine tumors. Neuroendocrine tumors are the tumor of your neuroendocrine cells. Neuroendocrine cells, they are a part of diffuse endocrine system. What is diffuse endocrine system? See, within your body, you have the endocrine system, which is made up of endocrine glands like pituitary gland, hypothalamus, adrenal gland. But along with these endocrine glands, forming the endocrine system are various cells scattered all over the body that also produce hormone just like the endocrine glands. Okay, endocrine glands are there in your body. These endocrine glands, they produce hormone and they make up the endocrine system. Just like the endocrine glands, there are endocrine cells scattered throughout your body, present diffusely throughout your body, that form the diffuse endocrine system. Now these endocrine cells, they are either present singly, isolated at a place, or they are present in a group. For example, within your stomach, you have the gastrin producing G cells. You have the serotonin producing argentaphine cells. Similarly, there are cholecystokinin producing cells. Throughout your gastrointestinal tract, multiple local hormones are produced. And these local hormones are produced by the endocrine cells. Similarly, within your pancreas as well, there are islands of endocrine cells referred to as islet of Langerhans. They are also diffusely present. They also make a part of the diffuse endocrine system. So, diffuse endocrine system contains endocrine cells either isolated or present in group that produce hormone, present scattered throughout the body, diffusely arranged in the body, present in various systems of the body, not just GIT. It is present in respiratory system as well, in other organs as well. These cells are referred to as the neuroendocrine cell. And the tumor of these neuroendocrine cell is the neuroendocrine tumor. Simple as that. I know I'm taking a lot of time to explain what neuroendocrine tumor is, but hear me out. This neuroendocrine tumor is seen in almost all the organs of your body. So throughout pathology, throughout the systemic pathology, under each system, I repeat, under each system, you are going to learn about various neuroendocrine tumor. And if you just know one single neuroendocrine tumor properly with concept, that concept is going to repeat in every neuroendocrine tumor. So hear this lecture very properly, because the concept and the ideas used here will be repeatedly appearing on and on and on in every systems. So neuroendocrine tumors, they are either well differentiated or poorly differentiated. For example, carcinoid, they are well differentiated neuroendocrine tumor. One last revision. So neuroendocrine tumors are the tumor of your neuroendocrine cells. Neuroendocrine cells, they form a part of your diffuse endocrine system. Diffuse endocrine system, it's a system of cells present either isolated or in groups, present scattered throughout the body, diffusely present throughout the body, that produce hormone. The tumor of these cells, neuroendocrine cells, neuroendocrine tumor, they are either well differentiated or poorly differentiated. Now we are going to learn about a well differentiated neuroendocrine tumor, and that is carcinoid. Carcinoid tumor. It is a well differentiated neuroendocrine tumor. It's a neuroendocrine tumor. That means it is arising from neuroendocrine cell. The question is, which neuroendocrine cell? There are many neuroendocrine cells throughout your body. G cell, argentaphine cell. It is due to the tumor of argentaphine cell. Which argentaphine cell? Argentaphine cell is also referred to as enterochromaffin cell or Kilczewski cell. Since it is a tumor of argentaphine cell, it is also referred to as argentaphinoma. Argentaphine cell is a part of apod cell system. So the tumor is also referred to as apodoma. Simple. Carcinoid tumor is a well differentiated neuroendocrine tumor. Since the neuroendocrine tumor is that of neuroendocrine cell, which neuroendocrine cell? Argentaphine cell. It is also called argentaphinoma. Argentaphine cell is a part of apod cell system, so also called apodoma. Done. Now, site, where are carcinoid tumors seen? It is most commonly seen throughout the gastrointestinal tract and then the respiratory system. Within gastrointestinal tract, you have three major parts: the foregut, the midgut, and the hindgut. The highest prevalence, the highest occurrence is in the midgut, in the intestine like ileum and appendix. In a respiratory system, it is seen in the trachea or bronchi or the lung. However, the highest frequency of occurrence is within the midgut, where the midgut of the gastrointestinal tract. So this is the introduction to carcinoid tumor. One last time. Carcinoid tumor is well-differentiated neuroendocrine tumor arising from neuroendocrine cell, which argentaphene cell, also called enterochromaffin cell or Kulczycki cell. Since it arises from argentaphene cell, it is also called argentaphenoma. Argentaphene cell is a part of Apud system. So the tumor is also called Apudoma. Where is it most commonly found? In gastrointestinal tract. Where in gastrointestinal tract is it most commonly appearing? In midgut. And then respiratory system like trachea, bronchi and lungs. Okay, grossly, carcinoid tumor is yellow to tan and form in consistency. It is yellow or a tan due to lipofuscin and form due to desmoplasia. Since there is desmoplasia, obviously in microscopy you are going to look at desmoplasia. See, throughout all neuroendocrine tumors, the diagnostic features are going to be similar. That is, microscopy is going to be same. Immunohistochemistry is going to be same. Electron microscopy is going to be same. So listen to the diagnosis very carefully because it will be repeating again and again and again. So first, the microscopy of carcinoid tumor. What is there? There is desmoplasia, lots of fibers. And in between these fibers, what are there? There are nests of cell. In individual nest, what are there? There are these tumor cells. And these tumor cells, they are surrounded by a single layer of special tumor cell. The tumor cell is special, this single layer, due to their arrangement because they are palisading. Palisading means one stacked over the other. So if you look at a single nest, this is what it looks like. The tumor cells at the periphery forming the boundary of the nest is stacked over one another, and this is referred to as palisading tumor cells. The palisading tumor cells, they are stacked one over the other. Okay, the palisading peripheral cell. Within it are the rest of the tumor cells. So what do you have? You have desmoplasia. In between these desmoplastic fibers, you have the nests of cell. An individual nest of cell is surrounded by palisading peripheral cell. Inside, if you zoom inside, right? If you zoom in, what do you get to see? You get to see these cells, right? Tumor cells. The special feature of these tumor cells are that, number one, they are small and uniform. Number two, can you appreciate the boundary of the cell? No, you can't, because it has poorly differentiated cell boundary. That's why. Second, it has less cytoplasm with a larger nucleus. So the nucleus are large, but the cytoplasm is scanty. Second, if you zoom into one nucleus, see, if you look at this nucleus right here, what do you see? Wait a second. All right. This nucleus right here. It is not solid. The nucleus does not appear solid. Instead, there are these dark dots present with white patches in between. Dark dots all over with white patches in between, giving salt and pepper arrangement. Because pepper is black, salt is white, the same is seen. It seems as if there's a plate with salt and pepper all over it. Salt and pepper arrangement. So in exam, in microscopy, what are you going to draw? This is what you are going to draw. So there are these desmoplastic fibers. In between are the nests of cell. The individual nest of cell has a palisading peripheral cell layer, and inside are the tumor cell. Is the boundary of the tumor cell seen? No, only the nucleus of the tumor cell is seen, and the nucleus shows salt and pepper arrangement. That's it. Immunohistochemistry. Remember these 6 that is common for all neuroendocrine tumor. Synaptophysin, chromogranin, bombacin, and NSE, CD56 and CD57. Electron microscopy. within the cytoplasm of the tumor cell, there are these granules, which are the neurosecretory granules. Tumor marker. See, it is the tumor of the argentaffin cell. Argentaffin cell is responsible for the production of serotonin. The metabolite of serotonin is 5-HIAA. So what is going to be seen, which level is, what is going to be seen region in the blood serum? 5-HIAA. So obviously the tumor marker is 5-HIAA. The metabolite of serotonin, 5-HIAA, is the tumor marker of carcinoid tumor.